Statins, like atorvastatin, are a cornerstone of preventative cardiology. In clinical trials, even low doses have been shown to slash LDL cholesterol by 30%, directly reducing the frequency of major cardiac events. But despite that documented efficacy, an estimated 10 to 15% of patients abruptly stop taking their prescribed medication. Most of these patients quit because of statin-associated muscle symptoms, or SAM. They report a range of physical distress, from persistent stiffness to severe cramping. This raises a question for researchers. Are these drugs actually toxic to muscle tissue, or is there a systemic misunderstanding of what is happening inside the body? Resolving this is critical. When a patient abandons a statin to avoid muscle aches, they leave themselves exposed to heart disease. We have to separate the biological reality from the noise. There is a legitimate, though rare, condition called rhabdomyolysis, where patients experience actual severe physical muscle breakdown. This occurs because lipophilic or fat-soluble statins can penetrate deep into muscle cells by passing through the cellular membrane. However, true rhabdomyolysis is statistically an outlier. Its extreme rarity cannot account for the millions of everyday patients reporting generic muscle aches and fatigue. Since cellular biology doesn't explain the sheer volume of mass complaints, the focus shifts. We have to look at the human mind. To find the answer, researchers launched the StatinWISE and SAMSON clinical trials, specifically designed to isolate the cause of statin-induced pain. These were N-of-1 crossover trials. Patients took alternating months of actual statins and empty placebo pills, without knowing which was which. Every single subject in these trials was a patient who had previously quit taking their statin specifically because their side effects were intolerable. The results were surprising. Patients reported the exact same high intensity of muscle pain during the placebo months as they did while taking the actual medication. This is known as the Nocebo Effect. It is a powerful psychological phenomenon where negative expectations actually manifest as physical symptoms. The widespread muscle pain is real to the patient, but chemically, it is noise. It's a powerful psychological response to taking a pill the patient expects will cause pain. Once the psychological noise is cleared away, we can see the actual biological signal hidden in the data. This table summarizes 13 major trials across various statin brands. The right-hand column shows a consistent, higher risk classification. This true biological side effect, a measurable risk of new-onset type 2 diabetes, is tracked consistently across major studies, particularly for high-intensity dosages. This 3D bar graph highlights exactly who carries this risk: patients already pre-diabetic or with a high body mass index. The tallest blue bar shows a BMI over 27 dramatically compounds this, pushing the diabetes event rate over 20%. This metabolic shift represents the primary biological cost of the drug, and it is concentrated within a very specific subset of patients. Leading medical institutions like the Cleveland Clinic have calculated whether this risk of new-onset diabetes outweighs the cardiovascular benefits of the drug. The math is based on scale. Meta-analyses show that for every 255 patients treated with statins over 4 years, there is exactly one extra case of diabetes. In that same group of hundreds, the number of heart attacks and strokes prevented is significantly higher. Because of this ratio, doctors advise managing the slight glycemic risk through monitoring and lifestyle changes, rather than abandoning the statin. The clinical directive states that the benefits of statins in reducing cardiovascular disease significantly outweigh a small increase in hemoglobin A1C. This data allows patients to shift focus from fearing the drug to actively managing their metabolic health, ensuring a strong, healthy heartbeat long-term. By separating the psychological noise of muscle pain from the true biological signal, patients can use one of modern medicine's most powerful tools for exactly what it was engineered to do.
The